My name is Mwangi Moraya Wanyambugi, a member of Nakuru Human Rights Defenders Network, and our common mandate is to protect and promote human rights in our county as well as in our country. And together with partners from Kericho, Narok, Baringo, Laikipia, and Nyandarua, the status of our county in terms of health raises a red flag on the state of the state of healthcare in Nakuru County. The system is under strain, people are dying, and leadership is alarmingly silent. Over past 5 months, the absence of direct and consistent leadership in the county has been deeply felt not as a political issue, but as a governance concern with far-reaching implications. While we respect the office of the governor, leadership cannot be symbolic when lives are at stake. We must raise concern about critical service delivery gaps, especially in the health sector, that require urgent attention. The closure of Nakuru Memorial Hospital, a facility that had served the region for over a century, has created immense pressure on Nakuru Level 5 Hospital. Its closure, despite existing court orders, was marked by irregularities, including the involvement of criminal gangs and disruption that endangered both staff and patients. This had a compounding effect of the Nakuru Level 5, which now carries a burden far beyond its capacity. Patients can face long waits, staff are overstretched, and in some tragic instances, lives have been lost. We emphasize that healthcare is not a privilege, it's a right. It must remain a political, professional, and accessible. We are increasingly concerned about the politicization and weaponization of healthcare, as well as instances of intimidation directed at those seeking transparency and justice. Every citizen has a right to accountability, and every healthcare worker has a right to safety and dignity in their workspace.
My name is Zipporah Kaleche, a human rights defender in Nakuru. Should I repeat? My name is Zipporah Kaleche. I'm a human rights defender in Nakuru. Our concerns are not speculative. They are evidenced by disturbing incidents. Among the evidence is the disappearance of baby Mercy's body from PGH mortuary. Elizabeth died at 27 while giving birth. Her child will grow up motherless not because of fate, but because the system failed her. The unresolved troubling death of Dr. Laban Langat, a young intern found lifeless under mysterious circumstances some time back. Each of these events points to a systematic vulnerabilities, not isolated failures. And while the county government has issued responses, tangible improvement in services remains minimal. Nakuru Level 5 is a referral facility that supports not just the county but the entire region. When systems break down here, the consequences are regional.
So thank you very much. My name is Stephen Kihara. So my name is Stephen Kihara, an HRD in Nakuru County. So our clarion call for this issue, first, we demand the immediate formation of an independent health oversight task force within 14 days to begin reviewing the crisis. Secondly, is fast-track the reopening of Nakuru War Memorial Hospital in compliance with court directives and public interest. The third is to activate the country's civic education and public participation unit to hold community barazas that allow residents to engage, be informed, and air concerns constructively. Fourthly is to increase staffing at all major health facilities, especially Nakuru Level 5, and prioritize staff welfare as well as safety. The second last is that we de-escalate the use of force and intimidation. So let civic dialogue and the rule of law guide accountability and not suppression. The last one but not least is work with national institutions such as the KMPDC and DCI to expedite investigations into the incidents criminal in nature and strengthen hospital safety protocols.
My name still remains to be Muna from Nakuru County, by my mother and father call me Maimuna Mwinyi. I'm a human rights defender, advocating and defending the right of human beings in Nakuru. So I'll proceed by saying furthermore, we emphasize that psychological well-being should be inseparable from physical health. Our health environments must therefore foster not only clinical care but human dignity and hope. This statement is not about blame, it's about responsibility. It's about thousands who depend on the county health system for life-saving care. It's about system working even in the temporary absence of a leader. We call on all arms of the county government to rise above politics and deliver services with urgency and compassion. We remain committed to supporting the county government in fulfilling its mandates, because a healthy Nakuru is a thriving Nakuru. And a thriving Nakuru means stronger revenue, better services, and more resilient society. Healthcare is not favor, it's a constitutional right. When leadership flatters, we all not say silence. Nakuru deserve health, dignity, and justice now. So we conclude by saying that we as human rights defenders, we are seeking for the government to absorb, accept, and implement our recommendations. As a concerned citizen of Nakuru, and the incident that just happened yesterday when a few of us who wanted to peacefully demonstrate and peacefully deliver a petition to our governor. And along the way, when they were awaiting for the other team to arise, they were badly harassed and arrested, and they were taken to the DCI's office, which they were denied their right to do a peaceful procession in order to be able to air out their issues. So for me as a citizen of Nakuru, I humbly request our governor and the entire leadership of Nakuru County and also at the national level to humbly allow us to peacefully share our grievances. And as we share our grievances, as our leaders, we request them to oblige and to implement our request, because it cannot be every day Nakuru people are crying. And we are crying because of our health system. We need a better health system, because each and every now and then, people are being admitted in the same hospital, not only from Nakuru, but also from our surrounding counties, which it is hindering in terms of services delivery and also in terms of revenue collection. And when you talk about revenue collection, that is what sustained the county. And having a county which is now a city, can they just, honestly speaking, take this city to the next level that is supposed to be by giving us the quality and quantity services that we are requesting as citizens, because we are paying taxes as citizens. So my biggest request is, don't just see us as we are talking because we are crying because of leadership. We are not crying because we want to cry. We are crying because we want better and good services for our county.
Now, how many were arrested and how long were they held this year?
At least 3 were arrested, 1 lady and 2 gents, and 1 PWD amongst the 3. And the lady was really beaten by the policeman, not a policewoman, which according to our law, a woman should be handled by a woman, but not with a man. So that is a true violation to that woman, a real violation to the PWD who was really harassed by police. They could just humbly just request them to on board in the car and be taken politely to the station. They stayed there for around close to 3 hours, and that is when we now decided to go and intervene and to get to know why they had been arrested arrested and been taken to the DCIs. To us, that is a form of intimidation which we condemn, and we request that it should stop. We should be allowed to exercise our constitutional rights because it is part of our constitution. Na hii katiba ni sisi wote tulipigania 2010 and we decided that we embody this constitution to guide us in a humane way. So we request them to practice and respect the constitution which is above all law.
Santeni. Nami, in this clarion call that you are calling our leaders for accountability, we'd like also to remind them that we have our constitution. As my learned friend here has mentioned, Article 37 gives us the right, to picket and to demonstrate. But what we saw yesterday, we want to condemn that and also to call those who will be accountable, who are responsible accountable for their actions, which was observed yesterday. And also in line to health, we want to also remind them that all we are calling for is the right for affordable standard of health as alluded or included in our constitution as well, under the Article 43 of our Constitution of Kenya. So we condemn all the harmful practices that are happening in Nakuru County, and we call all leaders whom we elected, starting from our president in the county level, that is our governor. We call unto her to take full responsibility pertaining the issue, because what we saw yesterday and was aired out, we condemn because it's an evil activity that happened yesterday. Thank you very much.
Tungependa kupongeza media, wanahabari wa Nakuru kwa lile jukumu ambalo wanafanya katika kaunti yetu na taifa letu na media yote katika dunia mzima, kwa sababu tumeona ya kwamba media ni jicho la tatu la taifa lolote ambalo linajali maneno yake. Jana wakati wale viongozi wa kijamii walipokuwa wanashikwa, kulikuwa na mipango ya kuabduct, lakini kwa sababu ya kuwepo kwa media kukimbia pale, maafisa fulani pale walisikika wakisema ya kwamba angalieni, watu wa media wameingia hapa na tulikuwa tumepanga kuwachukua kwa magari zingine, na wakasikika wakisema hizo gari zirudishwe kwa sababu watu wa media wangeweza kuziona. Kwa hivyo tunashukuru media na tunaomba serikali iwe ni katika county ama ya kitaifa waweze kuheshimu watu wa media, waendelee kufanya kazi yao, kwa sababu media is the third eye that we cannot do without. Thank you very much.